As part of the rollout, every part of New York has a regional vaccine network that's overseeing the distribution of the vaccine. Here in the North Country, that regional vaccine network is based at Champlain Valley Physicians Hospital here in Plattsburgh. And one of the components of that network is the Health Equity Task Force. And John Bernardi, the president and CEO of the United Way of the Adirondack Region, is the chair of that task force, and he joins us now. John, it's good to see you.
Thanks, Tom. It's always a great pleasure to be with you.
So tell us, what exactly does this task force do?
Well, the Health Equity Task Force is focused on two primary objectives. The first being to provide education, awareness, and concise information to people throughout the region about the vaccine and how to access it, particularly to vulnerable populations, Tom, people who are hard to serve or hard to reach or at risk or vulnerable for a variety of reasons. So our work is focused on creating equitable access to the vaccine for vulnerable populations. Financial instability can certainly create vulnerability. It may be disabled people, it may be older Americans, it may be homeless people, it could be people who are living in isolation or in very remote areas. As supplies become available, as you know, supplies are an important part of this, but as the supplies increase, we want to make sure that there is equitable access to people across the region.
And would you coordinate getting them to the state-run vaccination site over at the airport? Or is the hope that as more vaccine becomes available, that the hospital and the Clinton County Health Department may be able to set up clinics of their own in some of the outlying parts of Clinton County and the North Country?
Access, Tom, is going to be multifaceted. Of course, the state site is a very important component of that. And that's right here in the greater Plattsburgh area. There's also a site at SUNY Potsdam, but it's going to be multifaceted. We're working on a variety of other access points, which will include local pharmacies. And frankly, I think that's a really important network that we're working to develop. And again, supplies need to increase before that can really come to its full potential. But local pharmacies are going to be an important part of that network because they're much more accessible to vulnerable populations. In many cases, pharmacies are located right in the neighborhood where people are living. We're also going to be putting together, and local health departments are already doing this throughout the region, what they call pods, points of distribution. And these are going to be mobile units that are actually moving around the region within each county to provide access to vulnerable populations. And they'll be supported by nonprofits and faith-based organizations that are helping with transportation and volunteerism and other coordination. And the idea is to really make sure that we have equitable access for people. It's very easy for people like you and I, Tom, to go get our vaccine when we're eligible for it. We'll jump in our car and we'll go. We'll take time off from work if we need to. And sometimes we take that for granted, but there are people in our region who don't have those same luxuries, if you will. They struggle with transportation or time off from work or access to the internet or any variety of other challenges. Disabilities, could be mental health issues that they're struggling with. And we want to make sure that access is equitable across the board as supplies increase.
So you will actually help them sign up to get an appointment to get the vaccine. Will you also coordinate with groups to help them with transportation if necessary to actually get them to the site where they need to go?
There are dozens of agencies, governmental, nonprofit, and faith-based and medical, who are working together to create these mechanisms that will, again, foster this equitable access, which will include assistance with scheduling an appointment, assistance with transportation, and other assistance as needed.
And John, how can people find out information? How can they find out when these clinics are going to pop up in various parts of the region, or if the pharmacies are going to start offering vaccines to a larger chunk of the population? Where can they go to find out when and where these are happening and find out the information that the task force is talking about and what the task force is doing?
Right now, the best way for people to gain information is through the New York State vaccine website. There's a lot of really great information there. And then the other way is through the New York State COVID-19 Vaccine Hotline by telephone. And at this point, those two avenues are still the best way to find out information about A, your eligibility for vaccine, and B, your most convenient location and how to go about getting an appointment at that location.
Along with trying to get everyone vaccinated, 11 months into this pandemic now, what needs are you, the United Way, addressing at this point?
Early on in the pandemic, there were three major concerns. Food and food insecurity was one of those major concerns. Transportation was also an urgent need, particularly for critical medical transportation, like dialysis patients, for example. When public transportation and other modes shut down abruptly, there were people in the region that were feeling a crisis because their transportation was either limited or cut off. Then the other was childcare, particularly for essential workers, nurses, first responders, other essential workers. And those three items were really critical early on, so March, April into May. We have seen a real crisis emerging and evolving around housing and people being at risk to become homeless. And this has been growing. So rental assistance, mortgage assistance, assistance with back taxes, security deposits, first month's rent, housing availability. These have become really important issues that families are struggling with, particularly ALICE families. These are families that are low to moderate income and typically employed and struggling to either keep their home or keep their housing or to find adequate housing. And this continues to be a major issue. So yeah, families are struggling with a great many things: employment, the ability to keep a job, with remote learning for students. Families have really struggled with how to do that while keeping their job. And it's created a tremendous amount of stress for people.
John Bernardi, thank you very much for taking the time to be with us.